The average survival time for mesothelioma patients depends on several factors, including the type of mesothelioma, stage of diagnosis, the histological type, the patient's overall health, and the treatment received. Mesothelioma is an aggressive cancer that develops from the mesothelium, which is the protective lining that surrounds many of the internal organs of the body such as the lungs. There are three main types of mesothelioma: pleural mesothelioma, which develops in the lining of the lungs; peritoneal mesothelioma, which develops in the abdominal cavity; and pericardial mesothelioma, which develops in the sac around the heart. In general, the average survival times for mesothelioma are quite poor compared to other cancer types. For pleural mesothelioma, which is the most common type accounting for around 75% of cases, the average survival time if left untreated is typically between 4 to 18 months from the time of diagnosis. For stage I pleural mesothelioma, which means the cancer is limited to the chest cavity without invading vital organs or the diaphragm, the average survival time is 12 to 24 months. For stage 2 pleural mesothelioma, where the cancer has invaded the lung or the lining between the two lungs, average survival is around 12 months. For stage 3 pleural mesothelioma, where the cancer has spread throughout the chest cavity and may involve vital organs, average survival drops to around 9 to 12 months. For stage 4 pleural mesothelioma, where the cancer has metastasized to other parts of the body beyond the chest, average survival is typically 3 to 6 months. For peritoneal mesothelioma, which develops in the abdominal cavity, average survival times are generally worse than pleural mesothelioma. If left untreated, average survival for peritoneal mesothelioma is between 6 to 9 months. For stage I peritoneal mesothelioma confined to one area of the abdominal cavity, average survival is 15 to 22 months. For stage 2, where tumor growth involves more than one site in the abdomen but has not spread microscopically, average survival drops to 12 to 15 months. Stage 3 peritoneal mesothelioma, which involves the stomach, spleen, liver and intestines, gives an average survival of 9 to 12 months. Stage 4 signifies cancer spread throughout the abdomen and other organs, which gives very poor prognosis with average survival of only 3 to 6 months. Pericardial mesothelioma, which develops in the sac around the heart, is an even rarer type accounting for less than 1% of all mesothelioma cases. Average survival for pericardial mesothelioma has been reported between 6 to 18 months depending on stage of diagnosis. Earlier stage pericardial mesothelioma caught before spread beyond the pericardial sac gives a more favorable average survival of 12 to 24 months compared to later stage disease. The histological subtype or cell type of the mesothelioma also impacts average survival times. Epithelioid mesothelioma has generally better prognosis compared to sarcomatoid or biphasic subtypes. For epithelioid mesothelioma, which accounts for around 60% of cases, average survival is 9 to 12 months without treatment but can be extended to 12 to 21 months with aggressive trimodal treatment involving surgery, chemotherapy, and radiation therapy. Sarcomatoid mesothelioma has a much poorer average survival of only 3 to 9 months even with aggressive treatment due to its aggressive biological behavior and resistance to chemotherapy. The biphasic subtype, showing both epithelioid and sarcomatoid characteristics, has average survival in between the two main subtypes at around 6 to 15 months. Overall health status and performance status of the patient prior to treatment also affects average survival time for mesothelioma. Patients with good performance status, able to carry out normal activity without restriction, tend to survive an average 3 to 6 months longer than those with poor performance status who are restricted in their activities or confined to bed, chair. The stage of disease at diagnosis also greatly impacts outcomes, with earlier stage mesothelioma generally giving significantly better average survival rates compared to locally advanced or metastatic disease. Age is another determinant. Mesothelioma patients younger than 65 years of age generally survive an average 3 to 6 months longer than those older than 65 years. In terms of treatment received, aggressive trimodality treatment involving induction chemotherapy to shrink tumors followed by surgical removal of visible cancer, extrapleural pneumonectomy or pleurectomy, decortication for pleural disease, cytoreductive surgery for peritoneal disease, combined with radiation therapy provides the longest average survival for resectable mesothelioma. This aggressive multidisciplinary approach can extend average survival to 21 to 48 months or even longer in some cases of early-stage epithelioid pleural mesothelioma who tolerate the treatment well. For unresectable locally advanced or metastatic mesothelioma, average survival ranges from 9 to 16 months with cisplatin pemetrexed chemotherapy alone or in combination with radiation therapy or immunotherapy. More recently, novel combination immunotherapy and chemotherapy regimens are providing hope for improved average survival beyond 2 years even in advanced cases. Palliative chemotherapy or best supportive care alone gives an average survival of 6 to 9 months in poor performance patients with late-stage mesothelioma unable to tolerate aggressive therapies. Average survival times for mesothelioma range widely from 3 to 18 months without treatment up to 2 years or more with aggressive multimodal therapy for early-stage disease. Average survival is impacted by type and stage of disease at diagnosis, histological subtype, patient health status, and type of treatment received. Early diagnosis and trimodality management provides the best chance to extend average survival times for this challenging cancer beyond 18 months. Ongoing research into new targeted therapies and immune system approaches hold promise to further improve the poor prognosis for mesothelioma patients in the future.